Hello and welcome to the Southwest Indiana Internal Medicine Residency Program. I am Dr. Adrian Singson, the Residency Program Director. I'll be taking you on a brief overview of the program, our purpose, the consortium that we are part of, and the key players who have made this unique enterprise possible. I am confident that you will find our pedigree, vision, and future intriguing. We started in 2019 under our first program director, Dr. Robert Vicalora, and welcomed our first residents in 2020. As with all programs, the pandemic added a layer of challenge. But unlike many programs, our residents also have to juggle being an inaugural program. I take particular pride in our residents' resilience in shouldering being the first internal medicine residents in the region, starting up a new program, trailblazing medical education in a previously GME-naive location, and dealing with the pandemic all at the same time. When my predecessor built this program, he would say our program is young, but we aren't. Now I can confidently say that our program is young and established. The program is designed to address the primary care shortage in the area by training general internal medicine physicians for the region. Our residents will be educated to lead care teams, improve quality of care, champion organizational initiatives in a primary care model that is also a clinical learning environment. Pictured here are the facilities that you will be working at and training at. Both have received numerous accolades such as Magnet status, CARF, Commission on Cancer, and others. To the right is Good Samaritan Hospital in Vincennes, which boasts many new facilities without any clinical learning environments any older than 2005. Good Samaritan opened its doors in 1908 and was the first county hospital in Indiana. The psychiatry residency program is co-located here and started in 2018. To the left is Ascension St. Vincent Evansville, a large urban hospital that has been in existence since 1872 and is a level 2 trauma center with most of our subspecialties supporting our residents. Both hospitals that we serve are distinguished and well recognized with several awards. Pictured here are some of those awards that our sites have received over the years. I mentioned earlier that the residency program is designed to address the primary care shortage in the area by training general internal medicine residents for the region. The red box indicates the region we serve, but in reality, we have patients throughout the neighboring states as well. Due to the paucity of internal medicine physicians in the area, the residency program actually represents the bulk of internal medicine care in this region. On this slide, I wanted to share with you a brief overview of what it's like in the two cities that we serve. On the left is Vincennes, Indiana, a more rural experience in one of the oldest towns in Indiana. It is a small Midwestern college town with 10 universities in it, including the first university in Indiana. There's a fair bit of outdoorsmanship to be had in this area. Pictured on the right is Evansville, our more urban experience with a population of 300,000, one of the top cities to live in, with many amenities, access to other large cities such as Chicago, Tennessee, and St. Louis, all within relatively easy driving distance. The program is part of SIGMEC, the Southwestern Indiana Graduate Medical Education Consortium. SIGMEC's goal is to provide graduate medical education, attract new physicians to the Southwest region, and increase the retention of healthcare providers in the area. SIGMEC represents 4 hospitals that have come together with Indiana University School of Medicine to bring GME to the region. Pictured here are, going from left to right, are Dr. Heidi Dunaway, the Chief Medical Officer of Ascension St. Vincent Evansville, Dr. Steve Becker, the Assistant DIO and Dean of the IU School of Medicine Evansville campus, and Rob McClinn, the CEO of Good Samaritan Hospital. This illustrates that we get support from a lot of different venues, such as from IU, the medical staff, and the hospital C-suites. This shows the multiple levels of leadership and authority in Southwest Indiana who want us to succeed. SIGMEC consists of 4 hospitals: Ascension St. Vincent Evansville, Deaconess, Good Samaritan Hospital, and Jasper Memorial Hospital, who serve the Southwest region. Each hospital contributes funding to the consortium and the residency programs attached to each hospital, including ours. Internal medicine, psychiatry, and family medicine programs are all part of this consortium. both internal medicine and psych, are based out of Ascension St. Vincent and Evansville and Good Samaritan Hospital. One of the benefits of being part of the SIGMED consortium is that we are a program sponsored by Indiana University School of Medicine. We are not an affiliate. This has implications with regard to our program's access to scholarly resources, the nature of resident contracts as IU School of Medicine employees, as well as resident salaries and benefits. Our residents will graduate with an IU School of Medicine diploma. Due to our sponsored status, we expect to work with a constant influx of IU School of Medicine medical students on our wards and in our clinics. We also have access to the Stone Center, which is our state-of-the-art education center serving our medical students and the program. It has a robust didactic setup as well as a simulation lab. In 2015, Indiana lawmakers committed to expanding graduate medical education in the state. We are proud to be a part of that initiative. This resulted in massive state support for residency programs, including ours, on the order of $6 million to expand GME across the state over the next several years. Money is contributed by the 4 hospitals in the consortium, provide support to the various residency programs building up in the Southwest Indiana region. This all leads to our program receiving the economic support it needs to address the need for physicians, especially primary care, in this region. In addition, our resident physicians who choose to stay in the community are physicians making an impact by generating local and regional economic benefits as well as generating jobs. In summary, our program will address the primary care shortage by training general and internal medicine physicians. We are designed to train them in a primary care setting while also providing excellent, well-rounded training in other disciplines, including hospitalist medicine. And we are a community program with academic rigor unique to other community programs. What makes our academic rigor so unique for a community program is that we are built as an innovation platform, a learning laboratory for innovation in patient care, medical education, and scholarly inquiry. Our residents learn and teach in a team-based, transformed healthcare system with a focus on education as well as quality and safety as leaders. We adopt a Plan, Do, Study, Act approach, as well as use our innovation platform to generate scholarly activity. We have had 55 publications and posters in the academic year of 2021 to 2022, and that doesn't seem to have any signs of stopping. Our residents have won multiple awards at national conferences. We currently have a rate of 1.5 publications and posters per resident per year. Our residents have been involved and driven the creation of new rotations, pilots and other pilots utilizing their direct feedback, and all of our residents are trained to do evidence-based medicine using the McMaster system, and we have faculty with McMaster training. As part of our transition to becoming young and established, I am proud to announce that in 2021 we received our continued accreditation when I became the new program director. I am equally proud of our experienced program leadership team. Our faculty has the skills, background, and experience particularly suited for our mission. We have over 90 plus years of accumulated GME experience, faculty members with prior program director and associate program director experience, faculty members with prior residency faculty practice medical director experience, as well as 4 geriatricians. I would like to introduce you to our program leadership team. That's me in the center, Dr. Adrian Singson, a graduate of IU Health Balmoral Hospital Internal Medicine Residency Program, where I was a resident, chief resident, associate program director, clinic director, and then ultimately the senior associate program director. I have experience in the Clinical Competency Committee and Program Evaluation Committee. In the upper left is Dr. Bob Ficolora, our senior APD and our inaugural program director. He's from Mayo and started the Billings Clinic program in Montana. He is a nationally recognized medical educator, developed the Faculty Enhancement and Educational Development program for faculty development, and was involved in the Education Innovation Project with ACGME. In the upper right is Dr. Margaret Belleville, our APD also from Mayo, and an internationally recognized leader in perioperative medicine. She chairs our Clinical Competency Committee and started our program's perioperative rotation. In the lower left is Dr. James Butler, one of our APDs, who trained at Billings Clinic in Montana and developed our advanced hospice medicine rotation for our senior residents. In the lower right is Dr. Carl Sash, a respected Evansville physician and geriatrician for many years before pivoting his career to become a part of graduate medical education. He's one of our site directors and is a Duke-trained physician. Our program greatly benefits from having nationally recognized and deeply involved faculty. Many of our faculty members are leaders in ACGME, APDIM, the AAIM, and ARIS. Our faculty members are also deeply involved in ACGME, APDIM, AAIM, the AIAMC, or the Alliance of Independent Academic Medical Centers, as well as the ACP. Finally, our faculty members consistently produce scholarship and are invited as presenters at national level conferences. I've saved the best for last. I was fortunate to have studied under and been inspired by several excellent program directors in my career in GME. They all had very different philosophies and styles, but they all did one thing the same. The residents were the most important part of the program. What you see here is the inaugural class of our program, fresh out of their white coat ceremony, along with all the core faculty and key support personnel during our earliest days of existence. Pictured here is the current second-year class, also fresh out of their white coat ceremony during their internship. Pictured here are some of your future colleagues taking their Hippocratic oath. And finally pictured here are our current PGY1 class, your future colleagues, should you end up matching here. Our resident profile consists of 16 categorical residents and 8 preliminary residents, for a total of 56 residents between all 3 classes. We are proud to have attracted and continue to attract residents with local ties or who come from IU School of Medicine. Pictured here is Jacob Weinsapple. He's one of our seniors, a family man, and has a very precocious daughter. He's an Evansville native. I have a funny story about him in particular because I actually first met him during my previous appointment as a senior APD at Balmoral Hospital when he interviewed there. Medical education, I am told, is a very small world since I ended up working directly with him right outside his hometown. I said before that we are young and established. That rings no truer now than with our first graduating class. We originally did not plan to have senior residents when we recruited our first class originally, but we were fortunate to also match 2 upper-level residents. Pictured here is Dr. Adam Lundy, who has the distinction of being the first graduating resident from our program who has stayed on and joined as a teaching hospital at our Ascension St. Vincent Evansville site. His appointment is demonstrative of the program's longevity and the legacy we have created. Dr. Lundy isn't the only outstanding resident. Outstanding is the norm for many of them. Our residents' academic rigor and scholarship is atypical of other programs, and not just community programs. We have residents with publications in the British Medical Journal, residents who have won awards at the national level such as ACP, and residents who are invited to present at national conferences such as the American College of Gastroenterology, American Geriatric Society, and the ACP. In addition, we have a 1.5 publication per resident per year rate, and a scholarship council driven by the residents to engender scholarship and academic rigor as a culture. We believe that you cannot have a residency program without scholarship. Our residents have access to IU's impressive scholarly resources, as well as 90-plus years of GME experience through the core faculty, as well as faculty who have been published, wrote chapters or whole texts of medical literature, and who continue to engage in scholarly work at a national level. For the last several years, we've been involved in the Alliance of Independent Academic Medical Centers with their national initiative, which are venues that ensure posters and invited presentations for our residents and faculty. As we pride ourselves on being an innovation platform and innovation laboratory, we cannot stay stagnant. We are already heading into the future. Some big changes in the program have been the addition of the advanced hospice rotation, the addition of the perioperative rotation, and a skills simulation curriculum across both of our sites. Many of these initiatives are intended to address a potential future requirement regarding career-specific rotations. Finally, as part of the consortium, we are building the template for future expansion programs in the state of Indiana. Indiana University School of Medicine has committed support, personnel, monies, and resources to ensure the academic and clinical success of the programs in the consortium, including us. In summary, our program is young, but established. We have accomplished residents and eminent faculty, and we have an emphasis on education, academic rigor, and scholarship. I hope this presentation has been helpful to you, and we hope that you've taken an interest in our program for this recruitment season.